Gastroparesis. It's a chronic digestive disorder that causes abnormally slow emptying of the stomach. So here to talk to us about it this morning is Dr. John Saber with the Seton Gastroparesis Center. Thank you so much for being here this morning. So tell us a little bit about what this is.
Well, it's a chronic disease of the stomach, and it's caused by other conditions such as diabetes that affect the nerves and the muscles of the stomach, where the stomach just doesn't empty properly, doesn't function properly.
So how do you treat it? Do you treat the diseases causing it first and then get to that, or what's your approach?
Yes, if it's diabetes, absolutely, that disease is treated first, and then the most important thing is trying to make the diagnosis. It can be difficult making the diagnosis because the symptoms of it, such as nausea, vomiting, abdominal pain, can mimic a lot of other diseases. So once we diagnose it, then we have several options to treat it. First is dietary management. So patients can change their diet. Instead of 3 regular meals like we all have, we'll use smaller meals more frequent during the day. If that doesn't work, patients who are refractory to that, then we move on to medical management, medications. Unfortunately, there aren't a lot of great medications out there to treat the disease, and the ones that are out there have some significant side effects. If that all fails, then the new option we have now is surgical treatment. It's a gastric neurostimulator. And this is something I'm excited about and my team is excited about to bring to Central Texas, because previous to this, patients had to go to San Antonio or Dallas to get the treatment. So now we're implanting them here in Austin, and it's a neurostimulator, like a pacemaker, where as we can see on the graphic, the small pacemaker is placed beneath the skin and the abdominal wall, and then the electrodes are placed into the stomach wall, and those signals alter the nerves in the stomach, taking away the symptoms of nausea and vomiting in patients.
So how effective has it been? How many patients have you been able to use it on so far, since it's so new?
So far I've implanted 36 patients here in Austin. And it is effective. It's not a cure-all. It still it's highly selective, the type of patient that we pick to put it in. But it's very promising. The results are significant as far as reducing the symptoms that the patients have.
Now tell me, how do you qualify to get the surgery and the device?
First thing is just to be evaluated. Once a diagnosis is made, we evaluate a patient. We have a certain list of criteria as far as failing medical management. Of course, we try the non-surgical options first. If all that fails and the patients meet those criteria, we do an X-ray study where we study the emptying of the stomach, and if that is a significant prolonged delay, then we consider the patient a good candidate for the implant.
And if you need more information, you need to talk to Dr. Saber. There is the information there on your screen. The number is 324-8306, and of course you can visit their website at setongastro.com. So what should people do when they first realize they have the onset of symptoms? How long should they go before they come and see you?
Well, talk to your doctor. Again, other conditions need to be ruled out first, such as gallbladder disease, peptic ulcer disease, irritable bowel syndrome. Their doctor will treat them for those conditions. If all that's failing and they're still having symptoms, come see us. We'll evaluate the patient. We'll perhaps change their medical management and then maybe move on to a surgical implant if it's the right thing for them.
Thank you so much for being here.
You're
welcome. Appreciate it. We are now turning outside. Rhonda is in our first warning weather center with a look outside. Rhonda.
That's right, and it's a cloudy look. Unfortunately, folks, that's going to be our story for at least a while now. Right now, it's 50 degrees outside. Winds are calm. Not really blowing much of anything at this point. Across the area, though, our forecast is going to look a little on the soggy side. Right now, it is 50 degrees. By 5 o'clock, we're looking at 57 and mostly cloudy, and maybe a few showers here and there. 10 o'clock, showers do start to wane towards the morning hours in 51. I'll have your full 7-day forecast in just a little bit. It's 7:43. Good morning.
The holidays are fast approaching, and ABC has a way to shorten your to-do list. Hi, I'm Bobby Jenkins with ABC Home and Commercial Services, reminding you of our Holiday Light program. Our installation pros can design your lighting, then install everything using high-quality commercial-grade lights and timers. After the holidays, we'll return and take them down and safely store them in your attic for next year. Plus, you own the lights. It doesn't get more festive than that. ABC Home and Commercial Services, specialists for your environment.
Staying in tonight to save money? Eating at Logan's can be a better deal than cooking at home. Right now, 2 meals are just $13.99. All day, Monday through Wednesday, 3 to 6 all week. Pick 2 entrees from 12 different choices. Get 2 sides each and endless baskets of made-from-scratch yeast rolls. That's 2 full meals, just $13.99. All day, Monday through Wednesday, 3 to 6 all week. Now, get a Logan's Party Platter to go. Choose from 14 favorites, perfect for any occasion. Only at Logan's Roadhouse.
Austin Health is sponsored by St. David's Rehabilitation Hospitals.
When an accident, stroke,